The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited to have my guest on with me today. So, little quick backstory here. We actually met on the golf course. We're members of the same club. He said, you don't really kind of know what my business is about. And then I asked him some more questions. And then I was like, sure enough, yeah, I know what this is about. And did some checking on the guy here locally and just found out he's an outstanding gentleman. Craig Gibowicz, say hello to everyone.
Thanks for having me. And that is a true story. We can't make that up.
Yep. True story. Yeah. He said, I help practices, like when they're ready to change in their lives. And I said, you probably never heard of it. And I was like, oh yeah, I know what you're talking about. So, let's jump into your background, Craig. So you're with Menlo Dental Transitions, practice trans. You guys specialize in dental. I know you've got a long history in dental. I want you to talk about that for a couple of minutes. Tell me, how'd you get involved in dentistry? What's your history there?
Great. Well, Patrick, first of all, thanks for having me. And I'm so glad we we never would have met if it wasn't for golf. So I'm glad we randomly met that day. That was fun. Yeah. So I started about 25 years ago, worked for a manufacturer. I was fortunate enough, I went to interview with a company called Kerr because the person they interviewed right before me went to their corporate office and bombed. So his failure was my gain. And I met the manager, we connected, went to the corporate office, and that was 25 years ago about now, this June. And worked for Kerr on the manufacturing side, sold through distributors and kind of cut my teeth in dental. And then I was picked up by a large distributor that I sold through. And then for the last 20 years with them, I have sold supplies, equipment, technology, done consulting, sold practices, started that in 2014. And you name it, in terms of helping dentists grow their business is what we focused on. And then earlier this year, I was looking for a change. I have friends at Menlo Dental Transitions, and they asked me to join their team, and I cover the country and help doctors with their transition strategy when they're ready to sell, do a joint venture, find a partner, find an associate, whatever they're looking for, we can help them.
Yeah, fantastic. So 20 plus years in dental, right? Or probably pushing closer to 30 here soon. 20, we don't want to put any ages on it.
25, yep.
Yeah, 25 years. That's fantastic. So in that world of transitions, I'll tell you, I spend a lot of time on Facebook groups. People know that. In dental Facebook groups, there's a lot of noise, I want to say, when it comes to transitions, to buying, selling practices. It's a common conversation. There's a lot of debate. There's a lot of arguments. There's a lot of controversy amongst dentists. As we know, DSOs are a thing that people talk about, the good, the bad, the ugly, and all of that. So tell me right now, when you're talking to practices, when you're talking to dentists, and they're looking to buy or sell, what are some of the things that they're bringing you? What are some of the reoccurring questions that they're asking you, the challenges that they're having?
That's a great point, Patrick. I think the number one thing is confusion. There's so many rumors out there. There's so many misconceptions. And really, our goal in the beginning is when we meet with them to find out what they want to do. And there's 10 different ways to go. Not every person needs to follow the same path. And a lot of times their transition plan will be laid out for them without many decisions that need to be made. Depends on how large their practice is. Depends how long they want to practice after a sale. Depends on their age. Depends on if they want revenue up front or want to have equity in a parent holding company that's involved with a joint venture or DSO. There's many options. Some just want to go doctor owner, and that's fine too. What we like to do first is we'll meet with them and listen and find out what their plans are, what suits them best. And then after we learn about them and their vision, then we can take their very simple financials, prior 12 months P&L and production report, and put together a no-charge financial analysis. And that'll help us present to them their options. Once we see their revenue, we can limit or expand what their future plans can be. And timeline is huge. If they want to be done in 6 months, it's doctor owner. If they want to stick around 3, 5, 10 years and they're looking for a change, we can help them find the right group. And there are some great groups out there.
Yeah, makes sense to me. So let's talk a little bit about when to start talking to someone that can help you sell your practice. Personally, I think it's like when you start your practice, right? Or soon.
I think it's now. I agree now. now.
So I see this, I think there's a lot of dentists that think that their practice may be worth a lot more money than it is. They might be depending on that money to retire. That's a common thing. I mean, we get calls on the marketing side of things where, they thought they were going to sell this year, but they realized they don't have enough money to retire. And they're like, okay, now I need to increase the net worth of my practice. So can you help me do that? I think that's always sometimes it's a little tough if you're in your 60s, and I'm not trying to age date. I know a dentist, I just talked to one yesterday who's 80 and still rocking, but it might be a little hard, right? You may be going back to a 5-day work week or a full 4-day work week or something like that. So what can be done? And if you talk to a dentist today, what could you start talking about in order to make sure that they're maximizing the value of their practice and making sure that they're not leaving money on the table?
Well, we could tell them, that's a great point, and we can tell them now what their practice could be worth.
Sure.
What the range of value could be. And that's really important to know to find out where they can take it to, even if it's not transitioning for 5 or 10 years. They hear a lot about EBITDA and they hear a lot about groups, and that number is important, and we can help find that number for them. And looking at their P&L and help them find their EBITDA number to find out their value based on that. Or if they want to look at a doctor-owner transition and get more of that cash up front and sail off into the sunset in 3 to 6 months, that number is going to be net pre-tax income for the new buyer, for the new doctor owner, because that number's got to be substantial enough to attract a buyer. So we can get them values right now to let them know where they are, what cash at closing could look like with either scenario. And then they can make a decision from there. And they might be 30 years old and just want to know what their practice is worth. So then down the road in 5 years, we can meet again and we can see where they are. There's a squeeze right now on these dentists. Their overhead is high. Their revenue is stagnant, sometimes decreasing, and based upon insurance. Insurance rates haven't gone up. Some have gone down. So there's a squeeze on these guys right now, and we want to help them. And there's ways to figure out a method, whether it's if you take insurance, if you don't take insurance, most do. There's a way to keep your overhead under control to find more ways to capture more revenue. And they need help, especially these solo doctors. Like at Menlo, we have a team. We have a full team to help me and to help each other. A lot of these doctors don't. And so you're part of their team. I'm part of their team. And it doesn't cost them a penny. We can come in and help them and guide them in the right direction, all at no charge, just to be a resource for them, to let them know the options that are out there.
Yep. When we were golfing, I was asking you some questions about the company that you're a part of, and Menlo, and I know some people that help with transitions, but they're typically, it's like a single person shop, or maybe it's like one person and an assistant. And I can see how that might feel like there's a lot of hands-on, and that might be very well true. And I'm not saying that's a bad way to go. And I'm sure that you might not. I'm guessing you wouldn't have a blanket statement like, don't do that. But we can talk about the benefits. When you have an entire team, I'm going to talk about your team a little bit and tell me what goes into who are the people that are touching this practice and making sure that they come out on top of these transactions.
Yeah, that's a great point. And like you said, there's a lot of great brokers out there on their own, doing their own thing, and they're doing a fine, great job for these clients. For us, we're a bit of a unicorn. We're a little bit different. And we actually, I know this is hard to believe in 2024, we have a physical office where human beings go to, and they sit in chairs next to each other and collaborate and talk and look eye to eye and work together and have meetings. And we're figuring out how to grow internally and grow personally. So yes, we have certified valuation analysts in that office. We have transaction managers and transaction coordinators in that office. We have marketing in that office, advertising in that office. We have ownership in that office, brokers in that office. So yes, we have a full team working on selling your practice, and finding really the right buyer is the key, making sure your legacy, whichever route you take, is maintained and the outcome that you want is captured by us. We have a full team, and you can look online at our reviews and you'll see that there's 10 different names on each review because we have so many touch points to that client.
Yeah, makes sense. I mean, I think having a team is, obviously is a lot of times, and I would think most of the time can be a lot better with.
Personally and professionally, for sure.
Yeah, makes sense to me. So let's talk about crystal balls here a little bit. There's a lot of, nobody really knows, right? And at least maybe you do, and I'm sorry if I said that, but a lot of people think that DSOs are going to be backing off. You don't think so?
Well, I think it's going to be a lot of seeing where the market ends up in terms of making sure the doctor owners buy the right practices and doctor sellers either figure out a way to transition to a doctor owner or keep on the path to partner with a group. I don't think groups are going to take over the dental industry.
Right.
I don't think groups are going to hurt the dental industry that are already here or growing. I think there's benefits in both routes. I don't think a doctor that sees a friend sell to a DSO should have any negative feelings towards that. I don't think a doctor who's a partner in a DSO that his friend sells to a doctor owner should have any negative feelings towards that. I think there's room for both scenarios. I think there's benefit to both scenarios. It's personal preference. I think the groups have great resources to help dentists, but I also know the dentist, if he's 65 years old and wants to be done in 6 months, we can help find him a fantastic doctor owner to carry on that legacy, take great care of his patients, because that's the key. These doctors want to find a way to get paid what they're worth. They have worked hard.
Yeah.
They want to earn a great living, and there's nothing wrong with that.
Nope.
And they want clinical autonomy and to work on their craft and take excellent care of their patients. And both routes can accommodate that. There's no right or wrong or one model that fits every dentist. And that's where we come in. We help them dig into the layers of both aspects of dentistry and help them decide what's best for them and their patients.
Yeah, makes total sense to me. The last question for you, Craig, before we jump. If you're looking for someone to help you, if you're either looking to buy a practice or you're looking to sell your practice or maybe bring in an associate that you want to be a partner, that's kind of your vision there. What are the questions that you should ask? What are a couple, 2-3 questions that you should ask someone to help you with this process?
As a dentist?
Yeah, as a dentist. So if you're looking to hire someone to help you with a transition, what questions do you want to ask?
What's the process you guys take? What do you do at Menlo Dental Transitions to help us? And what we do at Menlo to help them is simply, first of all, listen, because we are not there to guide them in either direction. This is their decision, what they want to do and when they want to do it. So we want to be a sounding board for them and listen and find out what their vision is, what their end goal is, and what their timeline is and what they want. And once we talk about that, we can simply let them know there's different options out there and let them know that we can help them based upon their revenue and their P&Ls and production, which route might be more suitable to them. And so then they need to find out what we do as a company in terms of the process too. So not just me, but what we do in terms of closing the transaction, our network of people. Can we help with bankers? Can we help with attorneys? Can we help with practice consultants, CPAs? Do we have that network and team that we can build around them? So the doctor needs to find out if we can get them to closing, help them find which route to take, and have a team and a network of people to get them to that finish line.
Yep, makes sense to me. Craig, I want to thank you for being here. MenloTransitions.com is the website. Craig, I appreciate it. Thanks for taking the time to share. We want you to come back.
Patrick, thank you very much. I appreciate your time. Have a great day.